Welcome to a session on applying to nursing and midwifery. My name is Rakhee Rankin and I'm one of the associate heads for nursing and midwifery here at UWE. I work in the Faculty of Health and Applied Sciences and I'm a mental health nurse by background, and I am heavily involved in admissions around our undergraduate programmes. Although I'm going to be talking about the different fields of nursing and midwifery in terms of application, what I talk about is very applicable to other health subjects such as physiotherapy, occupational therapy, and paramedic science and so on. So if I focus on the different fields of nursing and midwifery, there are four fields of nursing: mental health nursing, learning disability nursing, children's nursing, adult, or as some people know it as general nursing, and midwifery, which is a very separate profession. So although we're governed wholly by the Nursing and Midwifery Council, midwifery is a separate profession to the other fields of nursing. So the reason why I would recommend people to do nursing and midwifery is because as nurses and midwives, we're committed to making a difference to people's lives. So when applicants are thinking about their personal statement, what they should be thinking about is what activities, and it doesn't have to be health-related activities, what activities have they undertaken that show that they're making a difference to people's lives. We also work with people in a person-centred way. And what I mean by that is that the person, the patient, service user, is always at the centre of everything that we do. The other thing that we focus on is family work and family-centredness. So for children's nursing in particular, and midwifery, the family is important in all the decisions that we make. Nursing, midwifery and other health professions have great employability and graduate prospects. As we're all graduate professions now, we really focus on getting people into the right high-skilled jobs, preparing them for employability, and through their placements they get a feel of what employability actually means, because they're obviously out there working in the field. And in terms of graduate prospects, these degrees can be used and transferred to any other sort of skill set or employment which is other than nursing, midwifery or health. An underpinning of what we do in terms of nursing, midwifery and other health subjects is making a difference through research. So gone are the days where you just did as you were told by the matron, but more has come into using research to justify what we do and why we do it. So what could students be learning as a nurse or a midwifery student? The first thing that we do is talk about communication, and not just talk about it, not just teach about it, but get students to practice communication. This is the one area that schools and colleges have fed back to me. It's something that they struggle with their teenagers, really. How to get them to express themselves effectively, especially as in our recruitment and selection, we focus on communication through a group presentation and individual interview. And it's not about the noisiest person or the most quiet person. It's about people who are able to communicate with each other in a kind, sensitive and compassionate way and be a bit of a team player. So that's what we're focused on when we come to selecting. We teach about pain management, dementia, and regardless of which field of practice that you go into, mental health, learning disabilities, maternity care, working with families and working with children, so across the age spectrum, is essential in everything that we do. Nursing midwifery programs and health programs in general have started to use simulation suites and Second Life, so avatars, as you can see on this screen, to enhance our learning. So it's very technologically based, and here at UWE we have all the technology in place to ensure that people can access things at a distance and reducing travel, or whilst out on placement and not having to come back into the university. We have the largest university in the southwest of England, and actually what we are doing in comparison to other universities is ensuring that our reading list consists of e-books and e-journals to make sure that students, wherever they are on placement or at home or abroad, they're able to access that information when they need it. Nursing, midwifery and health includes a number of practice experiences. So usually 50% of the curricula for all health programs is spent out in clinical practice. Now, clinical practice can include hospital care, including community hospitals, primary care, which includes GP services, hospice care, so end-of-life care, which can be quite difficult for people. And what we always suggest to our students is that they tell us if it's a particular place they really don't want to visit, because it's very challenging, and people have different experiences of accessing that kind of care for their families and friends. We also use registered care homes, which people might know as nursing homes or residential homes. The community, which includes district nursing or community nurses. Working with families, and learning disability nursing uses this very effectively, where a student will spend an entire placement with a family working with them. Not living with them, but working with them. At UE, we also give our students an opportunity to have 2 weeks in Croatia working with people with a learning disability, so understanding how nursing works on a global level, and also ensuring that we learn from them and they learn from us. And it's been very, very successful. At UE again, in the 3rd year, students are encouraged to undertake an elective placement, which is a 4-week international placement, and we're moving into the national profile as well. And some of the stuff that our students have been doing is, for example, working on the streets of Colombia with homeless people, working in the Rocky Mountains with mountain rescue. So they do a variety of things when they go on that 4-week placement. It's completely optional and people don't have to do it. And then, which is similar to other universities, they also get in the 3rd year an opportunity to apply for an Erasmus opportunity, which is an EU-funded opportunity for up to 12 weeks, probably in Norway or Finland, Spain and Germany. Post-Brexit, we're not quite sure what's going to happen to that, but universities are working with government to ensure that that funding remains. As I said, an essential part of health curricula is around learning through working with patients and their families. And here at UE, we've created patient carer feedback forms where our patients and carers are encouraged to give feedback directly to the student and also to the person who's mentoring the student and assessing the student. So these are the sorts of things that our patients and carers have been saying about our students. On any one day in the life of a student, they could be learning about infection control, how to address a wound. They might well be doing student-led presentation. The student-led presentations are really interesting because here at UE we get them to do a presentation within the first 4 weeks of them starting year 1. And the reason that we continue with presentations throughout their programme is because more and more all employers are requiring for first jobs that students do a presentation before they get offered a place of employment. They could be learning about pharmacological interventions such as medicines, or they could actually be out on placement themselves. What we find interesting is the perception of what nursing, midwifery or health programs mean, or careers mean. Typically it means shift work throughout the 37.5-hour week, which includes nights and weekends, and that's expected whilst they're on placement as well. Typical shift patterns, as you can see, are early shifts that start at 7, late shifts that finish at 9:30, night shifts that start from 8 PM to 8 AM, long days which are 12 to 14-hour shifts, and that's becoming much more prevalent across the country, where nurses, midwives and other health professions are expected to work 12 to 14-hour days. It's a demanding course where the Nursing Midwifery Council and other health bodies expect attendance, and it's not necessarily on set days and can impact on people's care responsibilities. but students do get holidays, perhaps not as much as a so-called normal student who perhaps does a maths degree or a geography degree, but they do get some holidays. Whilst out in practice, it's a requirement that every student has a mentor who assesses and who teaches and assesses them, other clinical staff who support them and teach them, and particularly unique to UE, we have academics in practice, so one of us goes out into practice every week to meet with our students in our areas to ensure that they're being well supported, and also to troubleshoot if there is a need for it. The kind of support that students get at university includes having a personal tutor for the entire 3 years, programme managers, student advisors, the student union, who are very heavily involved in ensuring good attainment and progression of our students, our library services, teaching and learning support, especially for people who have dyslexia or dyspraxia or any other learning need, and support for diverse faiths as well. So apart from the academic side of it, we are looking for people who are caring, compassionate, open and approachable, are a teamwork and have a positive attitude to wanting to be a nurse or a midwife or indeed another health professional. So when people are completing their personal statements, what would be really useful to understand and get from them is if they think they're compassionate people, why do they think they're compassionate? What experiences have they got that tells me that they're a compassionate person? So it's not enough just to put these words in, but it's about explaining these things, explaining how they think they've got the knowledge, skills or experiences that enable them to be a successful student, nurse, midwife or other health professional. This is a very typical entry requirement in terms of the academic side, and haven't included the EPQ there, but the EPQ is also an entry subject that they could use should they need to. So it is looking at A-levels, BTECs, 5 GCSE subjects at grade C or above, or even access courses that we look at as well. But that will vary from university to university. Other entry requirements, so quite a lot of entry requirements, include applicants must be in good health, and this is good mental and physical health. And at the time of acceptance onto the course, they're required to complete an occupational health clearance form. Now, it's not that people aren't allowed to come onto the course if they have some issues in terms of their health, but it's about how they manage that health. When was the last time they were unwell? What did they do? What strategies have they got? What support networks have they got to support them? These are stressful courses, and sometimes stressful courses exacerbate people's health needs. So we are very keen that people have a really good insight into what makes things worse or better for them. In addition, we insist on an enhanced disclosure environment, which is formerly the CRB, and each year there has to be a declaration of good health and good character. What we always say in terms of good health and good character, which is the DBS, we want people to declare this on UCAS, declare it at interview, and keep talking to us about these issues so that we can make informed choices and support people down the best career pathway, rather than making them think that they could get into the profession when actually they cannot. The personal statement must clearly demonstrate also a desire to be a nurse or a midwife, and very specifically about which field of nursing or midwifery, or in fact which field of health that they want to be interested in. If there is a wavering of opinion about what they want to do, this can affect people getting an offer of an interview, so they may well be rejected. And work experience does not have to be nursing. We know how difficult it is for our younger applicants to get that experience in nursing or care in itself, so we do look at non-nursing experiences. We recommend that students or candidates look at the NHS Constitution and really think about the areas such as being non-judgmental, caring, compassionate, and having a really good read of the NHS Constitution and the values that they indicate are required for working within health. In terms of selection, for literacy, for nursing and midwifery, there's a requirement that we undertake numeracy and literacy tests. We also undertake group activities, which we do in collaboration with our patients, their carers and practice colleagues. And it's a great opportunity to meet current students. So selection events are unique to Bristol, UE Bristol, but in essence, a lot of this is done very similarly across other universities. Not in the same structure, but certainly they will be expected to undertake numeracy and literacy tests, group activities, and also some have introduced, like we have, an individual interview. From September 2017, the government has announced changes to the funding for NHS courses, and I have to be really clear, it's not just about the bursary. Students are going to have to get loans to cover the fees and support their living costs. And on YouTube, Martin Lewis has done a fantastic podcast talking about the effects and the sort of the pros and cons really of this for health students. So I'd highly recommend that you go and have a look at that. So thank you very much for listening. I hope this has been useful for you, and I'm sure you'll be able to get in contact with the organisers should you have any questions that I can take via email in the near future. Thank you.